Hello? Testing, testing. Hello? Testing, testing. Okay, I have just reset the whole computer, restarted again. So if you're hearing me, on Facebook, I cannot hear it back. Please write somebody. Okay, Linda wrote sound is good, so I can go ahead and start again. Great. If there any issue, please let me know. Actually, this is my new location. I just moved in here day before yesterday, and I'm presenting from a city called Newport News. Okay, come back again. Today's session, Saturday, is a special session. Today's session is Introduction to Yoga Therapy. This is the part of the Yoga Teachers Training course by National Yoga Academy. So I'm going to teach for the whole day today. The session already started at around 9 in the morning. It will go until about 4:30 this afternoon. So first, for the students, we go with the definitions. The first definition is, how do you define yoga? Yoga is a philosophy and a practice, and its goal was for a self-realization. This was the definition from yoga scripture. The philosophy is called Yoga Sutra of Patanjali. It is 196 small aphorisms, of which 193 are to control your mind. The practice is called 8 limbs yoga. It is called Patanjali Ashtanga Yoga, and it's a sequence of steps towards the end of called Samadhi, which is a union of your body, mind, and spirit. You as a yoga teacher, you should memorize all the 8 limbs, and especially the Sanskrit name it came from. Yam, social restraint; niyam, personal restraint; asana, both physical and internal and external alignment; pranayama, voluntary regulated breathing; pratyahara, your control of your 5 senses; dharan, focus; dhyan, meditation; samadhi is union of your body, mind, and spirit. The root word is called your union, which is called a yog. It is a union of your body, mind, and spirit. Yoga therapy, way it is evolved, is that during the practice of yoga, there are some health benefits, and these health benefits can be used as an adjunct therapy for our Western medical practice. So yoga therapy basically defined as your adaptation of these yoga practices based on patient's clinical condition. Now you have to understand that this person has an underlying ailment, and you need to focus a yoga therapy for that person. So the understanding will be, you have the same tools, your philosophy, same 8 limbs, how to use them. If you have a physical condition, knee pain, hip pain, back pain, how to do that. If you come with a respiratory issue, say asthma, COPD, how to handle that. If you have a mental health issue, how to do it. And that is understanding that it is a long process. Like a regular yoga teacher's training is a 200 hours training, but the yoga therapy training is almost 800 hours, some of them 1000 hours. it's a long process. So today, what we're going to do for the students, we are going to use a asana this morning. Then we'll be teaching them pranayama and a meditation at the end of this session today. So this morning, I'm going to introduce the whole concept of yoga practices and how to incorporate and integrate in our Western medical condition. So the first and foremost way to introduce is a patient or a client comes to you who has not even heard what yoga is, who does not know how to get into yoga practice because his or her doctor has asked that please go to this yoga therapy teacher and he or she will teach you. And the reason is the word is already out that yoga helps. Yoga helps in combating chronic lifestyle related diseases. Lifestyle related diseases today, one is a truncal obesity, we call it your spare tire, or then your diabetes, hypertension, heart disease, dyslipidemia, that means high high cholesterol, then you have a high LDL, low density lipoprotein, high triglycerides, these are all, and the low HDL. So these are all lifestyle related disorders. So the first yogic concept is that you meet the person where they are. If a person can only sit in a chair, let them sit in a chair. If the person can sit down comfortably, let them sit down comfortably, because many of them will come to you, they already have a underlying some yogic practice. And the first and foremost technique will be, let them sit down with their spine straight. Very, very important yogic concept that you have to keep your spine straight. So if I'm sitting or I'm sitting in a chair, that I will sit down with my spine straight. Go to the back of the chair and keep my spine straight. The reason is my skeleton is unsupported, is going to fall in the front. So all the muscles in the back is contracting to keep me straight. So all the muscles in the back feels like a piece of stone with a tight. But the moment I keep my back straight, I start having some relaxation of these muscles. And basically a practice of yoga is a relaxation response. It's an activation of your parasympathetic tone. So what does it mean? In contrast to the exercise, because you know when you do the exercise that what we are doing, we are creating a muscle contraction. Heart rate goes up, respiratory rate goes up, your blood pressure goes up, and it allows me to do a fight or flight response. It's a survival response. When you are in the forest, living, some animal is coming and hurting you, you need to either fight or flight. And that is creating a tremendous amount of disease in our whole body, which is primarily, we call it a stress. Stress is sympathetic overdrive, which causes a lifestyle related disorders, diabetes, hypertension, heart disease, high cholesterol, truncal obesity. But yoga practice primarily is a relaxation response. And relaxation response, primary activation is called parasympathetic tone, and parasympathetic tone is called calm and digest. Whole digestive process from our mouth to your renal canal, whole supplied by your parasympathetic nerve. So digestion is the most important component of yoga practice. Yoga therapy is also a lifestyle. We call it dinocharya, daily routine, and it's called a lifestyle medicine. So we'll talk about all digestion, we'll talk about lifestyle, we'll talk about how to integrate yoga therapy with the Western medicine throughout the whole day. So the first component is, let them sit down with their spine straight. Next component is, yoga believes that this is a holistic practice. Holistic means whole. Holistic, I say somebody forgot to put a W in front. Holistic means whole. I'm not interested about the person who has the disease. I'm interested about the person. I'm not interested about the disease a person has. I'm interested about the person who has the disease. I'm going to do total global shifting. So what we find out in our experience and our research is the imbalance in both sides of the brain creates our lifestyle related disorders. Yoga says we bring the health. The moment you have a health, you don't have any disease. It's a very beautiful way of explaining. In like Western medicine, we say we do all the tests, your blood work, you do a mammogram, you get a colonoscopy, you get a cardiac stress test, everything is normal. We call it health. Health is the absence of disease. In yoga therapy, disease is the absence of a vibrant health. Means when you have a vibrant health, there will be no disease. And in yoga therapy, the health is defined as a balance of your body, mind and spirit. So all the balancing poses we will do as a part of yoga therapy. So here I am, I'm sitting down, I'm comfortable sitting this way, but if I'm comfortable sitting in a chair, if you put a chair behind me, I'll sit down, I'll keep my spine straight. Next thing, I listen to my body's signal. My first body signal will be pain. If I get a pain in this posture, I will back off. I'll back off, I'll find in a spot where I don't have much pain, I will stay in that posture or the asana. What happens, slowly and slowly, your brain gets a signal. And brain keeps on getting a signal which is called your neuroplasticity. Neuroplasticity means when you get 30, 40 signals, brain has changes, both functionally and structurally. Brain will allow me to sit like this. Then you go a little bit farther, brain will allow you. Slowly and slowly, a neuroplasticity will set in. So I think we overcome the technical glitches. So in stages, impossible become possible. So just also do one thing. The moment you practice the asanas, always try to concentrate. And the best way to concentrate in the mind, you close your eyes. When you close your eyes, you will see that all the information from outside is not coming to you. Yoga believes that you have 5 senses. I hear, I smell, I see, I taste, and I touch. 5 senses keeps us awake, alert, and that is called your mind. So if you keep your eyes closed, it helps you a lot. Then what you do, I'm sitting down here, then what you will do, you will cross the leg in the opposite side. See if you can sit down in the opposite crossing. What it does, it activates the other side of the brain. And in this posture, when you bring the relaxation, you will progress. And let me show you how to start the relaxation response. The first, as I said, you close your eyes. When you close your eyes, you shut down your 5 senses. Then your hand connects your body and mind. Hand represents the whole function of your mind. So if you touch index finger and thumb in yoga practice, this is called a Dhanu Mudra or a Dhanu Mudra. It is a meditation mudra. Put it over your knees, keep your spine straight, close your eyes. Now you bring your attention to your breath. By closing your eyes, you visualize your breath. Lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter to keep it open, and you have a 4.5 liter to exchange. But normally we only breathe 0.5 liter, 500 cc. So learn how to empty the lung first. So in all yoga practice, you breathe out first. So somebody comes and says, take a deep breath in. If my lung is full, and if I take a deep breath in, all the air will be sitting in the top of my lung. So breathe out first. Always breathe through your nostril. Do not breathe through your mouth. If you're practicing with me, you try and you'll see. Because when you breathe through your nostril, you breathe out first. Let's visualize. You're breathing through your nose. The nose is a big filter. Air is getting filtered. Nose is like your personal air conditioner. Outside air is warm, it will cool it down, and outside air is cool, it will warm it up. The air goes on the side of the nostril called turbinate. It's like a channel which creates a vortex. This vortex then slides over the mucosa of the sinuses, which are inside your nose, and from the mucosa it secretes a substance called a nitric oxide. Nitric oxide is a potent vasodilator. It opens the blood vessel and is the activator of your parasympathetic tone. There are a lot of other substances which activates parasympathetic tone. Cyclic GMP, So the air that gets directed into your larynx, through your trachea into the lung. So in a nasal breathing, all the air is going to your lung. If you breathe through your mouth, you have no idea where the air has gone in, or gone inside your lung or inside your stomach. Somebody tells me sometimes, I have to breathe through my mouth and I cannot breathe all from my nose. More physiological will be, you breathe in through your nostril, you can breathe out through your mouth. And the exhalation is a parasympathetic, inhalation is sympathetic. So your practice will be exhalation longer than inhalation, and your muscles of breathing are called skeletal muscles. The muscles can be trained. So slowly and slowly, without having any effort, you will be increasing the amount of air in and amount of air out. So let me show you a practice, how to do it. I already feel very relaxed. When you feel relaxed, you'll see you'll have some saliva in your mouth. When you have a saliva in your mouth, then you know that your parasympathetic tone is being activated. So when you have a sympathetic, when you're fearful, when you're afraid, your mouth becomes dry. But be sure that everything is working. Hey, your mouth becomes dry. I see some live videos interrupting. I have no idea what that is. Anyway, we're continuing. If you have a problem, please send me a little note here. Watching. Okay. If you have any problem, this is some technical glitches we cannot get over. So now, when I'm relaxed, I can go to the next step of the asana, which is called Siddhasana. Take the heel all the way to the back. Take your one foot in the top, and slowly you're going to come down. If it doesn't come down, if it stays here, let it stay here. Don't adjust, don't push it down. It's very important for the students. They always try to adjust. Don't adjust. If you keep here, eyes closed, have your hand mudras, do your breathing, this knee is going to come down on its own. It's a fascinating phenomenon, and you will feel a profound sense of relaxation. Now you continue your breathing, and if you're practicing with me, learn how to breathe out first. Simply you can do 2 seconds in and 4 seconds out without any effort. You will breathe in, 2 seconds in, 1 and 2 in. 4 seconds out, 1 and a 2 and a 3 and a 4 out. Very comfortable for me. 2 seconds in, 4 seconds out, 6 seconds a cycle. Your respiratory rate has dropped down to almost 10 now. Normally, respiratory rate is between 15 to 16 per minute. But I'm completely effortless in my breathing because I'm talking. I may be even singing. It is a wonderful experience. Now what you can see, the practice, what you can do, you can increase and slowly you will see the time of inhalation and exhalation will get longer and longer. We've been practicing for a long time, and I'll show you the stages, and you keep on doing it, and just do it about 5 to 10 breaths, and you'll have a profound level of relaxation. I'm going to show you count of 4 in, count of 8 out, like a 4 second in, 8 second out. Breathe out first. Very easy for me because I've been doing for a long time. I took a 4 second in and 8 second out. I'm still totally effortless. I'm still talking, I'm breathing. There is no huffing, puffing, nothing. Whole yoga practice is always behind your breath. It is called your foot shift to the breath shift. Any imbalance you create in a physical body, it shows up in your breath. Your next step, if you go a little further, show you the 6 second in, 12 second out. I'll breathe out first. I will slowly take a deep 6 second in and 12 second out. My eyes are closed, a smile in my face. Very easily I took 6 second in, 12 second out. Think about it. If I keep on doing it this, I develop the neuroplasticity and I'm breathing like that even in my sleep. So you have all the yoga practitioners when you're sitting down, and our breathing is totally, you're effortless. You cannot even hear that when you are breathing. And you'll see that their breathing rate is sometimes 1 or 2 a minute. We can do also 10 second in, 20 second out without any issue. Okay. Let me show you one, just to show it to you how effortless it is. I'll do 8 second in, 16 second out. Breathe out first. almost become 10 seconds in, 20 seconds out. It's a wonderful relaxation practice. Keep on doing it. You'll be sleeping like this in a breathing, and you will see whenever relaxation response, your blood pressure comes down, blood sugar comes down, your whole digestive process starts to get better and better. In a whole yogic concept, we say, the Western medical says you are what you eat. Yoga says you are what you digest. So now we'll see. When the relaxation sets in, I can sit down now. I can put down my one foot in the top, and this is called your half lotus, Ardha Padmasana or Swastika Asana. Listen to it. If you cause a pain, you back off. Find a place where you don't have any pain, but you have a little discomfort, called comfortable discomfort. Even if it is here, it's okay. Also notice in other symptoms. We have seen a lot of people say, when you sit down like this, I get a little numbness in my foot, numbness. So when you feel that, be sure you take care of it. Do not let it progress any further. Then you relax your upper part of the body. If you look at a baby, called hand relaxation, it is called a baby fist, Bala Mudra, or it's called your Adhi Mudra, yogic fist. Baby will close the fist, thumb inside and close. This is the way they will close. Thumb inside and close. And you keep on doing it, you will see your hand will get relaxed. When your hand is relaxed, your fingers get separated. When your fingers are, when the hands are tight, the finger doesn't go like this. But relax, your finger goes beautifully like this. All over, your hand gets completely relaxed. So you can practice the breathing. Put your hands in the front. Breathe out first. Take a deep breath in. Breathing out, use a yogic fist or a baby fist. Breathe in, breathe out. If you're practicing with me, let's practice. Do it about 5 times and see how you feel. Breathe in, breathe out. All the pain in the hand from arthritis, all the pain will slowly and slowly go away. Pain comes from tightness. The pain fibers are in the ligaments. Pain fibers in the muscles. Wrist gets relaxed with extension, and this is flexion. Breathe in, breathe out. Breathe in, breathe out. So, when your hands are relaxed, you know what happened? Body is so relaxed, and your whole body feels completely relaxed. And a person even sitting in a chair, they feel very comfortable. It's a wonderful experience, wonderful experience. You know, you cannot have it unless you practice it. It's called experiential. So I go to the other side, go to the opposite side, I put my one foot high up. It's a video getting interrupted. You know, I'm still having a little issue. I hope you guys can sing it okay. If not, this will be all recorded, so you'll be able to see it later. This is also on the other side. Remember the balancing poses. The balancing poses is the most relaxing poses. You can relax your shoulder. You can put your hands together, slowly bring your elbows. You know, if you cannot touch it, wherever it comes, then use your breathing. I do practice with my eyes closed. Breathe out first. Take a deep breath in and slowly rotate your shoulder. Shoulder is a ball and socket joint. Breathe in, breathe out. Breathe in, breathe out. And also do the opposite side. Breathe in, do from the opposite side. Breathe out. That's the way you relax your shoulder, relax your neck, shoulder, you can rotate your shoulder just because it's a ball and socket joint. And when doing it, you see very clearly how beautifully your whole body get relaxed. You can get up into a pose called your Lotus Pose. So in a Lotus Pose, what happens, initially it looks like, oh my God, how's a difficult pose. It's not a difficult pose. It just slowly and slowly you get a relaxation sets in. This is totally due to relaxation. It is not that you are trying. Yoga is not trying. Yoga is to let go. Let go, it will come to you. Exercise is a workout. I say yoga is a work-in. Or you can hold your wrist on the top, breathe out first, take a deep breath in and slowly pull it down behind your head. Breathe in, breathe out. The whole upper body gets relaxed with a asana called your reversed prayer pose to the back. So when you do a prayer pose to the back, let me show it to you how simple it is and how easy it is. It relaxes your shoulder, relaxes your whole upper part of the body. So slowly you can bring your hands and wherever it is, you bring it, stay here. Do your breathing out longer than breathing in. Slowly and slowly you will see, you will get a prayer pose to the back. When the prayer pose sets in, you stay in the asana, close your eyes, breathe out longer than breathing in, and slowly this thing will happen. You will get more and more relaxation will set in, and more and you stay. Longer you stay, you have a chest, these are called chest opening poses. These are very good for cardiovascular disorders. Improves your cardiac performance, improves your cardiac function, improves your ejection fraction. In a whole yoga practice, it improves your preload. More blood returns to your heart. And it also reduces afterload. So reduction in the afterload, increase in the preload, improves your whole cardiac function. It is a wonderful experience. Finally, what you do, you bring a breathing technique. It's called a bumblebee breathing, called Bhramari Pranayam. In a Bhramari Pranayam, you shut down your five senses. And when you shut down your five senses, your mind quiets down. Then you create a vibration like a bumblebee. Your brain has a vibration, you create a vibration, two vibration interacts and cancels, quiets down your mind. The way to do it, put your index finger in the forehead, use your three fingers to close your eyes, use your thumb to close your ear and close your mouth. You will be breathing out first, then you will take a deep breath in and breathe out through your nose with the sound of a bumblebee. And let's do it a couple of times and we'll see the effect of it. And if you're doing it with me, let's do it all together. Breathe out first. Take a deep breath in through your nose. Slowly take both of your hands, keep rubbing your hands. Keep rubbing your hands. This is called palming and cupping. When you feel the warmth in your hand, if you're wearing glasses, you can remove your glasses, then take both the hands, make it like a cup, put it over your eyes like a cup, let the eyes take all the heat from your hand, then you massage your forehead, massage your eyes, massage your face, massage your earlobe, massage back of your ear, front of your ear, in fact inside your external ear canal. There is a nerve called a auricular branch of vagus nerve. The branch of vagus nerve, it activates and stimulates your vagus nerve. Vagus nerve is your activator of parasympathetic tone. Bring your hand, massage your carotid sinuses. The carotid sinus here, carotid sinus relaxes your cardiovascular system, nervous system. It activates your parasympathetic tone. Take the hand to the back, massage the back of the head. This is called insertion of trapezius muscle and sternomastoid muscle. So if you keep on this very simple thing with a person who just came here to learn or how to integrate, relax your hands, relax your wrist, relax your shoulder, and slowly it will come to the point you will see what happens when your wrist or shoulder, wrist are relaxed, your hand will go all the way down and it will stay here like this. It's an amazing experience, when you do that. A relaxation, all the pain, the carpal tunnel, all the pain just slowly goes away. Finally, what you do a relaxation of your neck. It is called your Brahma Mudra. You have 4 positions in the neck, and always listen to your body's signal. Like relaxation, use your hand like a baby fist. It's called Adhi Mudra. Put your hands here. Slowly drop your head down. Breathe out first. Take a deep breath in. Slowly put your head to the back. And breathing out, slowly drop your head in the front. Listen to your body's signal. If there is no pain, just stay here. If there's pain, you can back off. But find the place where there is no pain, and then you stay here, breathing out longer than breathing in. Do at least 5 to 10 breaths in every posture, and you'll feel a profound level of relaxation. You also can incorporate the sound of a bumblebee. What it does, the sound of a bumblebee during exhalation, it extends your exhalation. It will look like this. Breathe out first. Take a deep breath in and slowly drop your neck to the back. Then with the sound of a bumblebee, you slowly bring your head in the front. It brings a relaxation, and it also totally quiets down your mind. Do from side to side. Breathe out first. Take a deep breath in the middle. Look all the way to the back without turning your shoulder. Breathe out first. Take a deep breath in. Finally, rotate your head left to the back to the right, then from right to the back to the left. Breathe out first. Take a deep breath in. When your neck gets relaxed, whole upper body relaxed, you can do it like a prayer pose to the back, reverse prayer pose to the back, and you can do this neck relaxation with the bumblebee breathing. You get a profound state of relaxation. In fact, when you're relaxed enough, you can do a very nice one. It's called your Uttanasana. You feel a lightness in your body and mind. You can put a hand on the both sides. You can press it here, so your whole body will go high up and will stay high up. And you can stay high up as long as you want, because you feel the lightness in your body and mind. So whole relaxation, when it sets in, you feel that it is not a single part of the body. When you start relaxing your shoulder, relaxing your neck, your whole body and mind get relaxed. Yogic position, there is a famous yogic position. It is called your squatting pose. We call it a malasana. When you do squatting pose, it relaxes your whole body. So simplest way of doing a squatting pose is you put down both the feet on the side and in a squatting pose. Here you can see the ankle is relaxed, your knee is relaxed, your hip is relaxed, your back is relaxed. Then you put your hands together. This is the way hand gets relaxed. If you see when hands are relaxed, all fingers are all separated. Put your elbows, one elbow inside, other elbow inside. Slowly bring your hands together. Keep your spine straight. Keep your eyes closed and do your breathing out longer than breathing in. It's a profound level of relaxation. At this level, you don't expect all your physiological parameters and get better. We do practice with all the health tracker. We practice with the Apple Watch, and we see all the time the effect of this. Next is to improve your health, to counteract all the lifestyle related disorders. See if you can do a sit rise test. You can get up without a support. From sitting down, you get up without a support, and you will see that the whole system, whole health, even in the cardiovascular health, gets better and better when you can do it. Next is what is most important from the yogic standpoint of therapy is the balancing poses. So first is called a sit rise test, then is your balancing poses. So sit rise test will be very simple. Like throughout the whole day you can practice, and wherever you are you can practice. You're sitting down in a squatting pose, very comfortably, and you get up without a support. Initially you won't be able to do it, but initially what you can do, you can hold into a chair or hold into a wall, and you can do it. Going against the grain of your habit is the yoga practice. And best way to do going against the grain of your habit is to be doing opposite of what you are comfortable with. I'm comfortable standing like this. My ears, my shoulder, my hip, my ankle should be in the same line. If I put my hands high up, sit high. Then to bring the balance back, say put my feet together. If I put my feet together, see if I'm putting it in a comfortable way. Then you bring the balance and incorporate sit, rise, test. Like I'm crossing my foot. If you're practicing with me, try. It is a wonderful practice to check the state of your cardiovascular system, check your overall health. You'll be able to sit down with crossing your feet, and you get up without a support. Initially, you may have to hold on to something, but again, you'll just get used to it. And you can do it very clearly. Not to the opposite side. I'm crossing my foot on the opposite side. Crossing opposite side, if I can sit down comfortably, and I can get up without a support. Once you have a practice like this, the balancing of equal on both sides, like I'm right-handed. I always want to use my left hand. I brush my left hand. I try to use my left hand to clean up, always. And I want to do it, my both sides of the brain gets activated. When you see the pranayama practice breathing, you'll see we'll do a lot of alternate nostril breathing. Alternate nostril breathing creates a tremendous amount of balance in both sides of the brain. Other way you can do, suppose I'm standing up, if I fall down, generally my hand falls down. So if I take my hands away, let's see, this is called a closed hand pose. Hold your right hand, hold your left arm. Left hand, hold your right arm. Very comfortable. More and more relaxed, more and more comfort you feel. I'm right-handed, right-footed, see if I can stand on my left foot. If I can stand on my left foot, 10 seconds, 20 seconds, 40 seconds. Once I can do like that, then I close my eyes if I can stand like this. Sorry. It initially becomes very uncomfortable. My eyes are closed. I'm standing on my left foot. By the time you're able to do it, most of your health parameters and function gets better and better. My eyes are closed. Very difficult initially, but slowly and slowly you get used to it. Then do the opposite side. Stand on your right foot. 10 seconds, 20 seconds, 30 seconds, 40 seconds. Close your eyes. Close your eyes. See how much you can do these balancing poses. Once you can do these balancing poses, you can say it's a wonderful practice. The whole health concept comes back. Next one, to improve your underlying chronic lifestyle related disorders, we call it a head below your heart. When you put your head below your heart, the pressure inside the brain goes high up. It is called intracranial pressure. Pressure inside the eyes goes high up. Then pressure inside your neck arteries goes high up. But if you keep your head down slowly and slowly, that pressure will slowly and slowly goes down, and this is called a baroreceptor sensitivity, and we call it a homeostasis. Homeostasis is a condition when body always wants to go back. We call it a reset mode, called a factory reset. So this is called, Sanskrit name called a Prasharito Uttanasana. So spread leg with the head down. What you do, put your head down slowly and listen to your body's signal. If your body's signal is fine, if you don't have any discomfort, initially your breath, you'll feel a discomfort in the breath, but when you can go down all the way, put your head down and stay in this posture, your whole body's hemodynamics gets better and better. Stay here for a while, between 5 to 10 breaths, and you'll feel the effect of it in your body and mind. So wonderful practices. Initially you may need to use a little bit of a chair or standing against a wall, but again you'll have no problem doing it and issuing it without any problem. Now all people talks about age, I'm 75, I'm 80, I'm 65. Age is a number. Age is not the issue anymore. And most important practice you need to do, you need to use a large number of large muscles. When you use a number of muscles, especially relaxation, you bring the whole concept of health. Let me show you a couple of them, like sitting down. And then what really brings your health and healing is your sleep. What happens today is our mind is in a state which is your emotional brain, called the limbic system. And when the limbic system is activated, what happens to that? You get a signal, goes to hypothalamus, it goes to pituitary gland, autonomic nervous system. Your whole sympathetic overdrive gets bigger and bigger. And then when you have an insomnia and a sleep apnea, it's a root cause of all of our lifestyle related disorders. The first, let's show a more comfortable or a bigger asanas. Okay, so show it to you. Adjust a little bit more. Sorry. You sit down in a posture, one knee on the top. It is called your Vaisasana or a buffalo. Buffalo, cows, you'll see, they all sit down like this. And when you sit down like this, it creates so much of a relaxation response that you feel comfortable. You're comfortable sitting like this. In fact, you're so comfortable that when you're normally sitting, your one leg will go high up without any problem. Always do it. Go to the opposite side. Remember, meet where you are, and in stages, impossible become possible. Why? It happened to all of us. Happened to you, happened to me, it will happen to everybody. This is called a cow face, Gomukhasan. Now let me show you how to do the whole Gomukhasan. You can see from the back, and then you will know what the balancing of the both sides means. Both sides have to be equal, both sides have to be balancing. Like here I am, my right knee is in the top of my left knee. Then my right hand goes high up. When my right hand goes high up, right knee is in the top of left knee and my left hand is here. Slowly I put my left hand in the midline and see how comfortably this right hand will come down. It will hook it, touch it, and essentially it will handshake each other. This way your whole upper part of the body is relaxed, lower part of the body is relaxed. We're in a profound sense of relaxation. When you try to do on the other side, you will see one side is more comfortable than the other side. That is your imbalance. When both sides becomes equally and comfortable, you are in a state of balance. Now I'm putting my left knee on the top of my right knee. Left knee is on the top, my left hand goes high up. Left hand goes high up, I put my right hand and slowly I'm putting my right hand in the middle and the center. Left hand comes down, I'm touching it, hooking it, I'm literally handshaking each other. And I'm feeling comfortable, and I'm feeling comfortable equally on both sides. This tells you that you are in a balance, performing both sides of the body. When one side feels better than the other side, then you know that you still have an imbalance. In yoga, health is defined as a balance of your body, mind, and spirit. It is a wonderful experience. Finally, you have to learn how to sleep properly. If you sleep properly, all of your lifestyle-related condition slowly goes away. So who is the most important person to sleep? The sleep first is the baby. The baby sleep very well, and the yogi. So in yoga practice, we learn how to sleep like a baby and how to sleep like a yogi. So now if you look at a baby, look at how they sleep. Here I am. I'm going to show you how to sleep. I'm laying down. I hope you can see me. Yes, you can see me. With my head down. Try to keep your head, chin below. If your head goes way high up, put a little pillow or put a little support underneath. If you see a baby, baby will sleep with the feet together like this. This is called your Sanskrit name, Supta Baddha Konasana. It is called sleeping closed angle pose. Baby sleeps or infant sleeps with their thumb inside and closed. Then the baby will sleep called abdominal breathing. When the baby inhale, take a breathing in, stomach wall will rise high up. Breathe out, it will go in. Breathe in, breathe out. So you sleep like this. That's how I sleep. I sleep all the time like this. I'll do at least between 10 to 20 breathing like this. When I do that breathing, my exhalation is longer than inhalation. For example, I'll breathe 5 seconds in, 10 seconds out. So let me show you a couple of times, but I will do at least 10 to 20 times. Breathe out first. Breathe in with a count of 5 in. Breathe out with a count of 10 out. Let me show you one more time. When you breathe in, your abdominal wall will rise high up. And out. It is such a wonderful experience, and slowly we'll see you could start falling asleep. It is called CO2 narcosis. Then you practice a little breath holding. Breath holding also helps you in your sleeping. Breath holding is also called activation of the vagal tone, parasympathetic tone. I'll breathe out first. I'll breathe in, count of 4 in, and hold the breath, count of 16, and breathe out with a count of 8 out. 1:4:2. And then when I get comfortable in the same ratio, I start increasing. I'll get a 5 in, 20 hold, 10 out. Let me show an example. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. I'm very comfortable. I'm doing it for a long time. Let me show you one more. 5-second in, 20-second hold, and 10-second out. Breathe out first. Breathe in with a count of 5 in. Hold for count of 20. Breathe out with a count of 10 out. So do it about 10 times. You will see I do it every single day when I sleep. Next, they sleep like a yogi. Yogis sleep like I call a fetal position, and they use the hand as a pillow, and they use it on the right side. They sleep on the right side. They'll put the head under the hand, they bend the knees, and they will sleep like this. Initially, body's temperature is way high up. On the right side, the left nostril opens up. Left nostril breathing is cooling. Again, it's a balance. The inside body temperature gets balanced with the cooling breathing. And after a short time, the yogis will turn and sleep on your left side. And I have been doing it for a long time, and it's a wonderful sleeping experience. They'll sleep with the head under the hand. They'll bend the knees like your fetal position, hand on the side, close the eyes, and they'll sleep. Sleep has a 2 cycle, REM sleep and non-REM sleep. REM stands for rapid eye movement, In a rapid eye movement, my mind is still active. You still get a lot of, like you get a dream, a lot of activity of the mind. But a non-REM sleep, which leads you to the deeper sleep, it has a 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 3 and 4 is about 50% of your sleep, and that's the time you see all the repaired work takes place. During deep sleep, the body's growth hormone starts to get increasing, and lot of repair of your body, lot of repair from your chronic lifestyle related condition gets better. You also, laying on the left side, there is a main blood vessel called inferior vena cava, which brings all the blood to your heart as a return. So when all the organs are shifted on the left side, this low pressure vena cava stays open and more blood returns to your heart. It's called a preload, and heart function gets better. We do the same thing for also prenatal yoga. When the uterus is bigger, we let them lay on the left side so the uterus gets shifted on the left side. It doesn't compress your inferior vena cava. You sleep like this, you get a total refreshing sleep. But if you're going to use a pillow, you can use a pillow and then put your hands like this on a pillow, and you will sleep very comfortably. Guaranteed, you'll have a wonderful sleep, and during sleep, all the physiological parameters go down. When you sleep, when you get a deep sleep, all the chronic lifestyle related disorder gets better and better. Because that is one of the underlying cause for your stress. And we know the sleep apnea causes all this problem. When you get up, straighten up your leg, put your one hand there, and you get up and you sit down again comfortably. Don't try to get up suddenly from your sleep. Take a little time, and then we have a daily routine which we follow, and we'll talk to you about again in a daily routine. We sit down in a squatting pose, drink a glass of water, then you have early morning bowel movement, then you do a tongue scraping, we do your jal neti, washing our nose, and then continue our whole day. Wonderful experience if you incorporate this slowly and slowly in your lifestyle, in your practice. And as I said, you always know that in stages, impossible become possible, and all the chronic lifestyle related disease and condition will get better and better. I'm sorry I'm having some technical issues today. And the first time I shifted my residence, and I'm in a new location today. Hopefully my internet will get better and get a better service, and we'll continue with the students soon. For the students, you come back in your Zoom link at 12, and we'll continue. In the meantime, you take a little stretch break and continue the practice. Continue your practice, and that's what your time has been allotted. Because most important thing about the whole day of this session is that we want you to practice more and more so you get used to it. Keep practicing, balancing poses, relaxation, and to come back next into the class again. See you soon in a Zoom.